My topic, most of you know me. I'm a naturopathic physician, specialist in clinical aromatherapy, plus many other things. And basically, almost every time in the conference, I talk about something that has to do with aromatherapy. This will not be the only topic because in the future I will be extending. Now, my topic has to deal with aromatherapy and autism syndrome disorders. Unfortunately, it is a highly debated, integrative, and complementary healthcare support. Why? There are very many reasons, and we will look at many of them as we go along. But it is something that I think must be addressed because we can help these patients, the families, and the caregivers through the use of aromatherapy. Now, it is very important to remember a couple of things. First of all, it is a developmental disorder characterized by impairment, development in communication, in social interactions, or behavioral problems. The autism spectrum disorders can differ greatly. We have disorders with mental retardation and certain medical conditions. Autism can range from severe to moderate, naturally. Mildly affected individuals may appear very close to normal, but they have substantial problems in relations and expression. Severely affected individuals may have an extreme intellectual disability and be unable to function in almost any type of setting. Now, when we talk about, excuse me, when we talk about ASD, we are not looking at something that is infrequent. We are looking at something that is on a rise at a very powerful rate. Um, we have to understand that autism affects 1 in every 54 individuals under 21 years of age living in the United States. And there is a 10% increase in prevalence from the previous rate of 1 in 59. So something in our way of living, in our genetics, in many other reasons, is increasing what is happening. And this comes from the Centers of Disease Control, and they say autism is on the rise. How many children are like this, closed in their world, or not being able to connect to the world due to impaired possibilities of referring their emotions or dealing with their emotions? And I want to talk about that because, as we know, we are talking about a neurological disorder. Now, what is the connection between neurons? Is there a difference with people with their connections that do not have ASD? And the difference is in how information is processed. So, withstanding that, we will not cure autism with aromatherapy. And withstanding that autism affects the way the nervous system processes information, which can lead to various difficulties, I think it is very important to analyze a little bit what structures and what implications do these structures have in autistic patients. Much of my consideration started, many of you might know that I do a lot of work in geriatrics and mood behaviors and difficulties in uh, behavior disorders for dementia and Alzheimer patients. And through this, I have seen that the amygdala is one of the main areas that we look at. But looking through the various updated researches in autism, it seems also that the amygdala is one of the main culprits in the development of the autism spectrum disorders, which means, for example, the amygdala is enlarged in 2-year-old children. And this begins an accelerated growth. And it starts at 6 months, all the way out to 12 months. This was a study that was funded by the National Institute of Health. Interaction of the amygdala determines on how we act in a crisis, depending on the information it receives. Meaning that if your amygdala is overstimulated, your anxiety will outweigh the logical parts of your brain and will cause you to panic. This not only happens in patients with dementia, but this happens with patients with autism. The amygdala, along with the rest of the limbic system, helps us recognize emotions in ourselves and in others. And if the amygdala, excuse me, I'm sorry, if the amygdala doesn't work correctly, we have already noticed that are we have difficulties in recognizing the emotions, and therefore we don't have the possibility of correctly understanding how to react to these emotions. There is a pivotal role in the emotional processing and regulation. And it's very important for us to understand that the emotional stimuli influences a wide range of behaviors that goes from fear response to social interactions. And all of this reminds me a lot of what autistic patients go through. Understanding the function of the amygdala is a crucial point, and it is very important to understand how it impacts the development of the brain and its association with various neurodevelopmental disorders. Naturally, the amygdala is one, and we're talking about many different areas, such as the prefrontal cortex, which helps modulate emotional responses based on context. It plays a very important role in adaptive behavioral communication. Uh, Disruption in communication can lead to difficulties of emotional regulation. Now, all of this leads to what we see happening in children and grown-ups with autism. The brain region is frequently connected to autism. Okay, so let's try to understand a little bit more. Structural changes, yes, there are structural changes, and we talked about it very briefly just a moment ago. Size and also speed and type of nervous communications amongst the various parts of our brain, especially connected to the limbic brain. Now, what is important to understand is that we see these abnormalities thanks to brain imaging studies, which most recently are starting to reveal what these structural abnormalities are. It's not only size, but it's the intricate network of connections emanating from the amygdala. And these studies suggest that the atypical connectivity patterns may contribute to the challenges in social communication and emotional regulation, which is commonly observed in autistic individuals. Before I get a little bit deeper into it, I just want to remind everybody that many autistic children struggle with interpret social cues. They don't know how to interpret them. They don't know how to understand them. They don't know how to understand emotional expression. And that leads difficulties in forming a meaningful relationship. And one of the main culprits is anxiety. The anxiety levels continue to be very elevated in this population. And this is partly due to the impaired capability of fear processing. All of this has a lot to do if all we have to do is look into the amygdala and the hypothalamus and other structures that are connected. So, my biggest question is how can we work to help the body re regulate up to a certain extent all of this? Now, addressing the role of the amygdala is crucial not just for the academic purposes, but for improving the quality of life of individuals, their families, and the caretakers who live in the ASD world. Well, when we talk about emotional recognition and we talk about problems with the ASD, many people start saying, okay, we have to address these amygdala related challenges requiring targeted interventions aimed at enhancing emotional recognition, fostering better communication strategies. But according to me, and I might be wrong, we're looking at it, we're putting the cart before the horses. How can we do that with people who live constantly in this problem? And unless they are given pharmaceutical support, and sometimes, most of the times, this pharmaceutical support is just a sedative, we do not allow them to um, in a certain way, recover the functionality of the amygdala. So, what happens to the amygdala? And this is very interesting because reading through a lot of scientific literature, I've read amygdala hijack, anxiety disorders, trouble with memory, difficulty with emotions, hypervigilance. But what does this really mean to us concerning the ASD? Hijack is when the amygdala, overwhelmed by stress, takes control of the brain's response. The amygdala processes fear and anxiety. So during a hijack, the frontal lobes, the logic centers, cannot provide a rational response. So how can we create something that allows the person to calm down when he's overwhelmed by the stress? And in autistic children and patients, being overwhelmed is a very easy factor. Anxiety disorders play a large role and have a lot to do with the symptoms of post traumatic stress disorders. Now, PST is not only, as we know, even though it started in the military, a military problem. We also have to deal with generalized and social anxiety disorders, panic attacks, obsessive and compulsive disorders. This is the amygdala. Trouble in memory. Though the hippocampus processes most of your memory, it's connected to the amygdala, and the amygdala helps you form emotional memories. So if it is highly stressed or highly hyperactive and amounts and excuse me, mounts the fear, the person is not able to form correct emotional memories. Difficulty in emotions. We can have a lot of emotion, but you might not have a normal fear response. It might be hyper, especially if your amygdala has a problem. Hypervigilance. You might always be on the outlook for a threat and expect for the worst, but that is stimulating your amygdala in a very unhealthy way. And this is something that these patients live 70% of the time. So how can we expect them, even if we try to give them the right environments and the right techniques, how can we expect them to be able to have a chance on working on these areas or giving the chance to the caregivers if we don't try to address on how to lower the hyperactivity in a natural way of the amygdala. These are all questions that brought me to this topic. Now, amygdala linked brain areas grow differently in autism, and we've seen that. Okay, researchers used structural magnetic resonance imaging to track the growth of 32 brain regions with direct connections to the amygdala. Very interesting study. What did it demonstrate? The study included 282 autistic children. 93 were female and 128 non-autistic children. 61 of them who were female. And it was interesting. When I started reading this, and I was saying, why female? Why are they stressing it? Because there's a difference between the reactivity in male and female autistic and non-autistic children. Okay, autistic children. Let's go step by step. The research scanned each child up to 4 times when the children were 32, 50, 39, 52, 64, and 137 months old. The autistic children had a larger amygdala connected brain regions than the non-autistic at all ages. The differences grew over time and were most apparent amongst the autistic children with prominent social difficulties. The researchers found no difference in the size of the brain and could not connect it directly to the problems with the amygdala. But there was a difference. And this difference led to social shyness and difficulty in emotions. So let's say, can essential oils support the amygdala? Sure, why not? We already see it that it supports the amygdala in patients with behavioral diseases and dementia. There are tons of research on this, starting from Melissa with Elaine Perry back in 1990, if I'm not mistaken, 7, one of her first studies. So, anti-stress and anti-anxiety. Yeah, we can use many of the researchers have been focusing on lavender, bergamot, chamomile, melissa. Why? Because their molecular structure has shown to reduce stress and anxiety levels. I want to remind everybody that essential oils have a molecular structure of what is called terpene structure. Now, terpenes are very small. They pass through the brain-blood barrier very easily. They connect very easily with the olfactic system, which initiates a whole series of reactions that help the limbic system re-regulate the body. Okay. And all of this has proven also on clinical research why we can use essential oils for anti-stress and anti-anxiety. Can it be used for cognitive enforcement? Sure. Oils like rosemary. These are just to say some of them. Rosemary, peppermint, spearmint, copaiba, frankincense. Allow an increase in cognitive functioning, which includes memory, vigilance, and mental fatigue re-education and reduction. So if a person lives the stress of difficulty in having any type of cognitive function, and we can lower that, just think of what we're obtaining. Just think of what we can help them with. Can we help the people with Autonomic nervous syndrome system modulation. Sure. Essential oils again, lavender, rosemary, grapefruit, just to say some. Lang ylang help influence the heart rate, blood pressure, cortisol levels, promoting parasympathetic activity and reducing the sympathetic response. Now, all of you well know, excuse me, that when we reduce the sympathetic response, what happens? Everything calms down. And if we can help the person calm down a bit, his stress factor will lower. Possibly he will not go into anxiety, and possibly he will be able to react better. I have seen this in patients with severe dementia. Um, and I'll give you a couple of examples once I finish this slide. Emotional modulation. Oils like yutsu, lavender, many citrus oils alleviate negative emotional states and improve the mood, therefore, behavioral problems. And here we go, behavioral and psychological symptoms of dementia. Cedar and many other oils. I could list probably the next 10 oils allow to improve these symptoms in dementia patients. Now, this is fundamental because why am I going back to a dementia patient? Dementia patients and autistic patients have very similar realities and reactivities. Dementia patient loses the idea of where he is and becomes aggressive, loses the capability of cognitive function, and his aggressiveness increases and he becomes isolated. The dementia patient also runs into many problems with the nervous system. Therefore, he lives on a high sympathetic basis. And basically, just using a very simple hand touch technique, which is a touch massage of the hand using essential oils. And this is research that has been done in the Moncuco Hospital of Lugano and the Hospital of Basilea in the geriatric ward, where nurses, family members, caregivers approach these patients. They allow them to smell the oil that are on their hands, and then slowly they get in contact with them and they do a hand massage. Now, one would think, okay, it's going to take a long time. No, in the next 3 minutes, the person relaxes. And at that point, you can work with him, you can clean him, you can take care of him or her. So, how come this cannot be used in patients with dementia? So, let's start thinking a little bit. These are some of the most, let's say, most recent studies. Okay. There are studies that go up to 2024, but I just wanted to put these. Diffusing essential, excuse me, diffusing essential oils, diffusing them, along with mindfulness exercises, call it meditation, can help children. And I love this expression, may help children with autism to maintain good, appropriate behaviors. Now, it's always a conditional in all the researches because there's too small of a group, there's not enough scientific evidence, and this also goes for dementia. Unfortunately, though, in the last almost 15 years, I have witnessed it every single time in patients with dementia and also in certain children with autism. In 2019 and 2022, suggested aromatherapy may decrease stereotypic behaviors occurring in the response of overstimulating situations, sensory overload, large crowds, loud noises. This is referred naturally to dementia, but it's the same exact situation that we encounter for patients with autism. Suggested that may decrease. I understand the scientific necessity of saying this, but there's a little bit more than just suggested. In 2018, suggested that the application of essential oils, such as Lang Ylang, to say one of them, okay, may be effective in managing, may be effective in managing emotional outbursts and aggression. I put these three because I personally, as a specialist in clinical aromatherapy, would take away the conditional verb and I would put an affirmative verb. Science does not accept it totally because the cohort numbers are too small, because there's not enough scientific evidence on exactly what pathways, even though we know that it works on the GABA system, we know that it works on hormones, we know that it works on serotonin, we know that it works on melatonin, and it works on a lot of other hormones that affect our response. But on the other side, I want you to look at this. This comes from a study done by the parents, and it's the evidence-based result, which unfortunately are not enough for science. But look at the numbers, please. 84% of the patients reported medium to significant overall benefits from using essential oils. 61 reported that the oils helped pacify their children during meltdowns or sensory overloads. 77% reported that they reduced the hyperactivity levels. 56% of the parents felt that their child were more relieved from anxiety, stress, attention deficit, and anger. 79% reported reduced discomfort due to sensory sensitivity. And most importantly, 88% were happy with the overall effects and said they would recommend to other parents. Now, they might not have the scientific values of the pathways, but they definitely have the evidence basis of 724 hours a day, lifetime with their children. And in front of this, I really want to start stressing that we should all begin to understand why frankincense oils, how can it be benefit? It is beneficial because it helps everybody to stay focused. It is also known to reduce stress reactions and negative emotions. How do you use it? Very simply, you can apply it. I use it, for example, when we talk about stress reactions. I'm sure that many of you are aware that stress reactions in patients with Parkinson's disease increases their Parkinson's syndromes. Well, I have been using for years now 1 drop of frankincense 4 times a day under the tongue to reduce the stress reactions and increase their possibilities, there being the patients with Parkinson, to have a better life and a better outcome of their syndrome. Then, vetiver. Vetiver is relaxing and calming and has helped children combat symptoms in the ADHD and the ADD symptoms. And therefore concentrating and being easily distracted and impatient. We could use that definitely in patients with autism. Let's talk about sandalwood. Promotes mental clarity, especially when used with a diffuser. You don't even have to apply it topically, diffusing it. It also has a relaxing and calming effect that can help children with the autism spectrum. Why? Because it relaxes the amygdala. It doesn't relax it, excuse me. It modulates the amygdala activity, lowering naturally what is the sympathetic nervous response. Cedarwood. It has calming and relaxing properties. Just think the simple breathing it out of the bottle for 3 minutes, and this is a study that was done, promotes the release of serotonin, which is then converted into melatonin in the brain. This can help the children enjoy a peaceful and restorative sleep. Lavender, which most of us know, it has a very calming effect in children with autism and can help improve the sleep quality and reduce anxiety and emotional stress. And we saw that these anxiety and emotional stress is what is the trigger to many of the reactions and overreactions due to environmental stress in autism patients. Mandarin is very useful because in many children, they like it because it's sweet, but it helps to reduce the anxiety levels. Peppermint, very good for children with autism, ADHD, and ADD because it gives a cooling sensation and calming effect to the body. It is also known to help improve mental focus. And this, for example, without going into patients who have disorders, is something very essential that has been used for people who study. Lang Lang has a very strong, effective sedative, antispasmodic, and antidepressant property. And it has a very positive effect on regulating human emotions. Bergamot. Now, bergamot is a very specific oil and very special because on one side, it's a very good mood enhancer. Okay. On the other side, being that it contains linalool and linalool acetate at a very decent level, it also helps to create a sense of tranquility. And it's very important for the autistic. But it on its opposite side, being a citrus and having a high level of D-limonene, it creates a feeling of joy, freshness, and energy by helping improve the circulation of the blood to different parts of the body. At the same time, as I said, it is considered relaxing and calming. Therefore, it does reduce the levels of stress and anxiety. And then there would be a ton of things to talk about with the Melissa officinalis because it is a oil that definitely is fundamental in the approach of behavioral problems, mood shifts, and this was one of the first studies done by Elaine Perry concerning uh, dementia patients because she wanted to find a way on how to help these patients without using the usual sedatives or hypnotic drugs. Then, at this point, once we have helped the uh, the autistic patient find his oil, and at this point, somebody would tell me, "Well, how do they really figure out what oil they want?" Well, it's very simple. Make them choose it. This is the most non-scientific piece of advice that I can give you, but it's on a very strong scientific basis that has to do with quantum physics. Their body will be attracted to what they need. They automatically know. This happens in animals. This happens in children. This happens in autistic children. This happens in people with dementia. This happens with people in Alzheimer's. I have been doing this for the last 10 years. I allow them to choose and then we work on it. And never once have they chosen the wrong oil. Maybe they have chosen sometimes, and there's a second verification. You make them breathe it. And if you see that they enjoy the response, fine. If not, they don't, you have them make a second choice. But at least maximum with the second choice, what happens is that they find the scent that allows them to reach a new regulation, a new modulation of what is the activity definitely going on within their brain in the limbic system, directed basically by the amygdala, but with all the various interconnections, be it the prefrontal, be it the cerebral cortex, be it the thalamus, the hypothalamus, and so on. Now, I didn't want to go into molecular um, structures and so on, because that could be something for a second time. What I wanted to do was one thing very simple. I wanted to have you see what essential oils can do, and I wanted to talk about also the aromatic touch massage. Now, clinical studies have shown that various types of massages reduce the child's anxiety. Some of them are strong massages. Some of them are instead touch massages. The touch massage in general, excuse me, helps various things. It allows them to increase the linguistic abilities and social communication. Why? Because the touch massage allows them to recover contact and allows them to become, once again, less fearful. It helps them increase their tolerance to touch. And this is very important with autistic children. When an autistic child's tolerance to touch increases, his and her aggression and anxiety diminishes. In a 2014 study published in Frontiers in Psychology, the touch massage has given evidence to support oxytocin potential importance and increase in production. It led us to understand that there is a very strong response in the activation of various types of sensory nerves. Oxytocin appears to increase an individual's sense of well-being, reduce stress, and improve levels of social interaction, which is exactly what we want for these children. Massages reduce the children's anxiety, improve social communications, and favor formations of closeness and bonds with the parents and also with the caregivers, thus bringing the prospects, these children, to develop a better interactive world. Doesn't resolve it, but it gives them a fighting chance. It is proven to increase the dopamine, the feel-good hormone, so-called, and decrease cortisol, the stress hormone. This helps regulate the anxiety and stress, which lead definitely to a strong imbalance when there is social, family, and academic pressures, which unfortunately come out because people are stressed with dealing with the autistic children. Massages can also stimulate the vagus nerve, which affects other body outputs, heart rate, and so on. This decreases the heart rate, for example, allowing people with ASD to focus more and sleep better. Furthermore, it can decrease the incidence of seizures, which is very common in 1/3 of the patients with ASD. Some studies indicate that the touch therapy didn't help in muscle spasm, but helped in social anxiety. Sensory massage, which means also using essential oils, is very important for the child's sensory preferences and sensitivities. It involves a gentle touch, pressure, rhythmic movements, provided to provide a sensory output and input and promote relaxation. If you add on essential oils, you have reached a 100% goal, which is very simple. My final considerations. Let's integrate aromatherapy. It's not a cure. Nobody ever thought it was a cure. I have never used it as a cure, but I have used it as a strong emotional and behavioral support to create a personalized and dynamic routine that offers caregivers and family members a possibly new paradigm, offering a better quality of life. We don't want to harm, but we want to create a better environment, relieve antagonistic reactions that offer these children, their families, and the society a better chance. I want to thank you for your attention, and I hope that this very quick, not too much in depth uh, talk triggers in each one of us the curiosity to look into how we can help, also with many other techniques and other remedies to regulate the amygdala and the response in these children. Thank you very much.